condition, we find that uh, we get we can say that very very predictable, or we are conditioned in our own system that either we are using only mental symptoms or keynotes or therapeutics. So in that condition, all other cases or all other information or different approaches we are not able to use, and that is the we can say that biggest uh, hurdle in our daily practice, and that leads to failure. So if we talk about this, so we can see that different cases express differently, right? In some cases we get keynotes, in some cases we get pathology in the center, or in some cases we only get totality, in some cases we get the whole case together. So in any given case, this is the most important thing, okay, how to understand that case. And so we can say that the true skill of homeopathy is not use not just one type of information, or not just one type of analysis, but to blend, to be flexible, to use whatever information is there for the advantage of the patient. But for this, we should first know that what are the information we generally get in any given case. So in any given case, we get different set of symptoms. Suppose in one case we get only totality. Suppose, and in another case we get totality, and along with totality, we get either a keynote or in essence, right? In other case we get only essence. In some case we get whole. Whenever we say whole, means that we get essence plus totality and plus keynote, means we are getting the essence of a pulsatilla. Then if we repertorize that, we get overall totality of the pulsatilla, and then we get confirmation of the confirmatory symptoms of the pulsatilla. And in some cases we get only keynotes, right? And in keynotes also there are different criteria. Suppose sometime we get the keynote which is the which is not only the keynote of the part that represent the whole case, and we can name that as keynote incense. And in some cases we get only keynote of same area. Suppose fear, we get three types of the fears, or we get desires, aversions, right? That desires, aversion represent only the git, and fears only represent the mental state. So we can say that keynote from the same area, but and sometimes we get keynote from the different areas, that one keynote from the dream, one keynote from the git, another keynote from the extremities. So how we can evaluate them, or how we categorize them, that we can understand the which is the what information is important. Suppose in any given case we are having a totality of one remedy, but the keynote of but the keynote is expressing some another remedy, or we can a sense of an atramure or a keynote of a thuja. Now what to do? Do we have to prescribe natamir or thuja? So these are the main major difficulties which we face in day-to-day practice. So first we have to understand what are the information. So the first information, which is the most we can the strongest information, the strongest cases which we normally saw in seminars, are the cases which represent the whole. So when we say whole, means they are having the essence, they are having the totality, and they are having the keynotes. But in other cases, in many cases, we get only essence. And when we say essence, what we mean by essence? And sometimes we get overwhelmed with the idea, or we get carried away with the word essence. Essence means the mental state or something. But no, we have to understand from where this word comes. This word is given by Dr. Vitholkar. So when Dr. Vitholkar said essence, he does not mean essence only a mental state. He divided essence in the four stages. That is, first causation, second speed, third center of pathology, and then physiognomy. Suppose causation of any remedy along with the speed, like the slowness of bryonia and gelsemium is essence of bryonia and gelsemium, right? Then center of pathology. And very commonly we give example of the three acids, that picric acid, acid phos, and muriatic acid. That the center of pathology of the muriatic acid is in the physical plane, and the center of pathology of the picric acid is in the mental plane, and the center of pathology of the acid phos is the emotional plane. So these center of pathology is also the part of the incense. Then the physiognomy, the build. When we study sepia, we study the physiognomy of the sepia, the flattened body. So that is also the part of the essence. So essence is not just a mental phenomena, which we mostly think that it is only a part of the mental phenomena. Then after essence comes the totality. We all use regularly the totality, but we mostly use totality in a mathematical way. And in the previous session, we discussed in detail that how we can use totality or a repertorization in a more intelligent way. But in today's session, we will try to understand how we can categorize, or how we can evaluate the different information in ascending order, that which information to give more important, and then how we can use them for the prescription. So in totality also there is two conditions. In totality, sometimes we are having an essence plus totality. For example, the essence of natromure and the totality of the natromure, but no keynote confirmation of the natromure. But sometimes we have the essence of natromure in keynotes of natromure. Suppose we are having the whole essence of natromure, then we are having a version for the slimy food, that is a keynote for the natromure, but we are not having a totality, because when we are repertorizing, the natrium is not coming in the repertorization chart. So now what to do in this condition? And then comes the keynote, and that is the most important thing which we use regularly, that keynotes. And normally we overuse them. So in keynote we have to understand two things. First, do this really a keynote? For example, to qualify for example, any symptom, to qualify a keynote, for a keynote, it should be very, very strong. It should be PQRS. Along with that, after that, that symptom should be expressed rarely in the repertory of the materia medica. Suppose you are having one symptom, any symptom, or symptom A or B, and when you go back to the repertory and you have 50 odd remedies in that symptom, it is no longer a keynote. So keynote is a PQRS in a repertory, PQRS in the materia medica, and PQRS in the patient. I can give you one example. There's one patient of pyrexia of unknown origin not responding to any medicine, even homeopathic treatment. When I went there, when I take his case, I found nothing, no symptoms in fever or any other condition or in the previous history, but I found only one symptom, that in while narrating his problem, he is coughing only once. Now, we know that in the repertory, we are having this keynote in the Calcarea cough in single paroxysm. But now, in this condition, how to use this? So, now we know that this is the keynote of Calcarea cough, because this symptom, cough in single paroxysm, and is only expressing in Calcarea cough. But do this symptom present in the patient? This is very important question, which you should ask yourself. For that, I should be very, very sure that this symptom is present in this patient. So in whole conversation of 30 or 45 minutes, if he cough twice, only once, then I will not consider this symptom as a keynote. So keynote we can use only when this is very, very, we can say 3 plus 4 plus 5 plus, that we have to reconfirm that he only cough in a single paroxysm in every conversation, then and then only we can use that. So keynotes are very important, but we have to understand them. I want to give you one example of that. And to use them, we should know our repertory very well, right? So like, these are few information which we get from the patient, and we can use that these information as a keynote. Like, for example, there is a patient who is having the profuse sweat, and it is causing the great weakness and the muscle loss. Now we must know where to look for this in the repertory. And again, there is one patient which who is having perspiration with only weakness. So there is no muscle loss, there is only weakness. And there is a patient, suppose a Punjabi patient who is having a party in which he is having a wine, chicken, and dance, and after that he is feeling confused. Is feeling confusion after that. Now, where to find this in the repertory? Patient having a hot, aggravated by the hot, damp condition, and there is a patient who is having a desire. We normally use sweet desire, but he or she is saying that I like candies or Bengali rasgulla, strong sweets. I like strong sweets. Or there can be a patient who said, "Okay, I like exclusive dishes." So we must know our repertory very well, that where to find these rubrics. So in first example, in which there is a profuse sweat which is causing a great weakness and muscle loss, we know that there is a rubric in the repertory, that is sweat qualificative. Right? Now we have to differentiate from the other thing, that is perspiration which brings weakness, that is sweat debilitating. Right? So we must know the difference between the rubrics, and we must know the rubrics also to use for the patient. And a next rubric in which the patient is feeling confusion after this party, there is a rubric in the repertory, carousal aggravate. And next, we know that patient is aggravated by hot damp condition, and we know that the rubric is sultry weather aggravate. Right? And when we say the patient said that I like strong sugar, then we must know that the rubric is desired dainties. And when patient said that exclusive, I like exclusive dishes, we must know the rubric. The rubric is delicacies desire. So the perfect balance of the knowledge of the repertory and the knowledge of the keynote, we can bring them together for the betterment of the patient, and we can get our result more positive in that condition. Just a minute. So after knowing the keynotes, we must understand various type of keynotes. So one keynote can be, we can name that keynote essence. So they are no more a keynote, because the whole, for example, one lady came to me. She's suffering from cough from 6 months. She's not responding to any treatment. When she came to me, she narrated her story that she went to her in-laws, his daughter house, the in-laws of the daughter, and there she faced a lot of insult, a lot of, and she lot of insult, her and her that in-laws torment her daughter a lot. When she came back, she is very irritated, she is very angry, she is irritable, she feel insulted, she feel humiliated. And when she came back, the cough started, and after that it's going on for 6 months and not responding to any treatment. So in this case, there is one keynote which is covering the whole case. Now it is not, we can say that this keynote is not for the cough only, it is related to the whole case. For example, in this condition, the patient is aggravated by excitement, emotional excitement. So there is a rubric in the repertory, the cough agitation from. So in this rubric, so when we see the remedy sister scan, it is written every mental excitement is followed by stitching in the throat producing cough. Mental agitation increases the cough. So in this case, this keynote is no, we can say that this covers the whole case. So this is not referring to one area of the case. So we can name this as a keynote essence. And then we can have, in any given case, we can have keynote from three different areas, right? Or one area, for example, fear of dark, fear of death, fear of alone, fear of water, remedies stramonium. Or desire sweet, desire salt, remedies argentum nitricum. Desire salt or desire whiskey, remedies leccan. But in this case, the keynote is referring to only one area, right? For example, another case, the keynote are referring to three different areas. That fear from that, for example, we can say fear of dark, right? And then desires sweet, then we can desire whiskey. Now if we compare these two, the second part, the second area in which keynote is expressing different area is more important than keynote in the same area. So we have to categorize that information. Now, how to categorize that? Now, how we can categorize that? We can know, we can understand that there are different set of information which we get in the case. So we can have the holistic understanding in which the essence and totality in the keynote is expressing or pointing to the same remedy. Or we can have the essence, or in that essence we can essence plus totality, right? Suppose essence of natromere and totality of natromere, we can have that. Or we can have totality plus keynote, or we can have only essence, or we can have only totality, or keynote essence, or keynote of different area, or keynote of same area. Now how to categorize that? Suppose we are having a holistic information, so this is of the prime importance in any given case. And if we are not having that information, then rather than making that case for that, for example, if we are fixed that we have to use the totality, then we try to fit, then we try to bring totality in that case. But we can have essence in that case, right? So rather than fixing that case into some fixed dimension of our mental state, we have to, hello.
Yeah, I think there's some internet issue happening. We seem to have lost Dr. Yogesh again, but he'll be back. Some internet issue there with Dr. Yogesh. I hope you're all enjoying it. Okay, I hope you're all enjoying this webinar as we wait for Dr. Yogesh to reconnect. Yeah. Yeah, that's right, Mansi. Dr. Yogesh is so good at that. His explanation he gives on how you systematically frame the repertory is what is one of Yogesh's expertise, if I can say so. Yeah, he just had a serious internet disruption there in his town, in his city. So I think he's just restarting everything. So he'll be with us in a few minutes. So welcome to everybody else who I couldn't. Poonam Batra, Palak Vora, Anita Chawla, Usha Pradhan, Anjum Syed, Ruchika Charanjit, Poonam. How many of you attended his last webinar? Yeah, he just called me now. Dr. Yogesh called me now. He'll be rejoining us soon. Okay, we are okay. Waiting, no problem. Thank you, everybody, for holding on. Sometimes we just have a bad connection. You want to join your friend Durgesh? If you can, you can type out his email. I'll email him, and he can join us immediately. We have Jagat Singh Pangal, who's on Facebook now and has asked, "What is the advice for relief on insomnia?" Jagat Singh, I think we really need to sit with a homeopath. We have to take your case before the homeopath can decide uh, which will be the right remedy for you. Oh, Syed, that's good. That's good. You're here for the second session as well. So Dr. Yogesh is going to be doing a few more seminars for us on the periodic table, and which we are just finalizing. It will be a series of seminars which he's going to be doing. So we'll keep you updated on that. That's nice, Syed. You were on the FB page. I attended his Vaishali. That's good. So we have a lot of people here who have attended his earlier seminar. So you can all see a continuity in the learning. Hi, Smita from Facebook Live. She's just joined us. Shivam Gupta has just joined us on Facebook Live. Ati Ganga Naidu from KL, Malaysia has just joined us on Facebook Live. While we wait for Dr. Yogesh to join us now. So just so that we don't spend, where are you all from? Can you just type out on the chat box where you're from so we get an idea of where our viewers are from? Hello, Smita. Hello, Vinita. Vinita lives in London, I think. And Srinivas Rao, hi there. Louis Stern from South America, I guess somewhere. Durgesh is from Mumbai. Ibtisam is from Nagpur. Dr. Minal Chitnis is from Sharjah. Charanjit from Ludhiana. Sonam from the US. Oh, that's good. That's we've got like people from all over the world now. Mansi is from New Jersey. Shubro is from Kolkata. Anybody from Chennai? Oh, Sridevi is from Chennai. That's good. Charanjit, if you missed the last webinar and you'd still like to have a look at it, just head over to our YouTube channel and you can see his last webinar. So if you then you can see Vijay Shantani is also from Chennai. I'm from Chennai myself, so that's nice. That's nice to meet another Chennai. Smita says a big hi from Canada. Nikita from Pune says hi. Edel says hi from Ireland. Vishaka says hi from Pune. Ati Ganga and I do, and I go back a long way. He's a doctor in KL. Niranjan Sahu is from Jharkhand. Hi Genoveva. We're just waiting for Dr. Yogesh to log back in. I think he's have some serious issues. And if any of you have your voice on or the camera on, let's see you. I've just given Poonam Batra the Jagat Singh, who's on Facebook, is from Ita, Uttar Pradesh. Let me just see. Dr. Yogesh is coming online. I can just see him logged in. Yes,
Hello.
yes, yes.
Sorry, sir.
Welcome back. Welcome back.
So there is an internet issue. Sorry, sir.
No, no problem. No problem at all, doctor.
Okay.
It's understandable. Yes, please go on, doctor.
Uh, let's summarize once again.
Yeah.
So, as we talked till now, that in any given case, we are having a different set of information. So, how to understand that and how to apply that practically, this is the most important thing. So, the slide you are seeing in this, that in any given case we are having the first, after taking the case, we have to see what information do we have in that given case. Are we having are we having an essence, or are we having a totality, or are we having a keynote? So these understanding is very important. Suppose there is a case, there is a patient of mine in which the whole case revolves around the one information, that is embarrassment, embarrassment, embarrassment. In that case, there is other information like a repeated death in the family. There are more information which are pointing to the same remedy, a remedy like childish behavior, and when we get all symptoms together, that essence or totality in keynote, we get the one remedy that Ambra agrees here. So in this cases, in that case, we can say that in any given case, when we having a essence of the same remedy and totality of the same remedy and keynote of the same remedy, in that case is having the maximum chances of getting cure. But in there are another set of cases in which we are having a essence, or we better to say essence plus totality or essence plus keynote. In last session, we discussed one case of retention of urine in which patient is having retention of urine for 14 days, but she is having no symptom. And along with that, and she told me that during pregnancy, she is not aware of the pregnancy till 9 months. It means in pregnancy also there is no symptom, right? So in this case, this particular information that no expression of the symptom, and we commonly use one rubric in that condition, that painlessness of the painful condition. And if we understand the whole case in this information, the painlessness of the painful condition is not present only in the pathology but also in the pregnancy. So we can say that this is the essence of that patient, along with that confirmatory, that is urinary retention after delivery, and his mental state, that is contentment, and we combine together, we get essence of opium, and along with that other symptom, or we can say are having the essence of the opium, and we are having the totality of the opium, but we are not having a keynote of the opium. In other condition, we get totality of some remedy and keynote confirmation for that remedy, but we are not having essence. For example, we repertorize, we get natrum muriaticum, we are getting in information like slimy food aggravate of natrum muriaticum, we are not getting the whole essence of natrum muriaticum. In other case, we get only essence. Like few days back, one patient came to me that is having a lot of stress in her life. The whole essence in her case is like somebody is dominating him and somebody is abusing him, and that is the whole area of her which is disturbing her is revolving around me versus another. And in that cases, we normally that person on whom I am depending for love, care, affection, and that person is betraying me, or that person is abusing me, that person is hurting me. In this particular case, we tend to use the remedies like lecananum or like defloratum. But in that particular case, she is having one more information which is very important, that she is very, very ambitious. So in this case, we can use another lac, that lac caprinum, which is having that part also, that area of abuse, and along with that abuse, there is an area of ambitiousness. But we are not having any confirmation in totality or keynote for lac caprinum, but we are having only essence. So in other cases, we have only keynote. Right? So uh, we have to make ourselves, and we should be very, very clear that in any given case, what information we have to use for that patient. So whenever we get fixed with our application, like we have only to we have to use only repertory, or we have to prescribe only on the keynote, or we have to prescribe only holistically, we get fixed into that whole box, and then we we start getting failures in that cases. So the key for any given case, or we can say that key in a practice, is understanding the whole case and what information we are having. Are we having a essence or are we having a totality? And if we are having a totality, then what are the things which are confirming that totality? So the whole key, which I think, is flexibility. If we really understand our system well, if we really understand the keynotes, if we really understand our materia medica well, or if we really understand our repertory well, then we can use best for this patient. So this is what I have to share for today. And once again, I like to thank Dr. Karthik for giving us space and support, sir. On the behalf of Dear and I Love Homeopathy, I really want to thank Dr. Karthik Raghavamurthy for giving us space and support, sir. Looking forward to for the space. Hello.
I think Yogesh is still having another problem. Let me try and get Dr. Yogesh back on. Yes, let me get back Dr. Yogesh so you can ask him which slide is that, Anita? Which slide did you want to see? Mansi, can you just wait for a minute? I'll get Dr. Yogesh back online. And doctor? Yes, doctor. Yeah, no, no problem. Can you just come on? They want to ask you one or two things and then we can close. Okay, 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 doctor. Yeah. Yeah, he's got some serious issues there on with the internet there. So he's starting, but what we'll do is we'll be emailing you the link of the YouTube video that we will upload once this is over, along with the PowerPoint that he's shared with us as a PDF file. So you can all have something to uh, read and understand. So we'll just wait for Dr. Yogesh to log in. So in the meanwhile, do you have anything to ask Dr. Yogesh when he logs back in? You could you could type it out in the conversation box, and I'll ask. He will also be able to see what you've typed out. if anybody would like to come online who have their cameras on, their mics on, they can also come online and ask Dr. Yogesh. So, in the meanwhile, what I'm going to do is I'm going to start with the YouTube of looking back for that slide. Doctor? Yeah, doctor's back.
Hello.
Yeah, doctor, can you hear us now? Yeah,
Yeah, I can hear.
yeah,
Yes.
yeah. There are things. Looking back for that slide, what was the medicine that you suggested for that kid looking back?
Uh, just a minute, sir.
So this was for the kid looking back. That symptom that you gave.
Okay, okay, okay. So no, so in that case, I am giving. I want to express that if we get fixed to, suppose if we get if I get fixed to one type of understanding, suppose if I get if I fix to just a keynote prescription, then I am not able to understand the holistic understanding of the patient. In that particular case, when kid look back, in that thing, what happened? That person. Hello. Which I have selected is multi-dimensional approach in homeopathy and role of repertory in holistic prescription. So, idea for taking this topic is that why there is a need. First of all, this thing came to mind. Why this is the need for today generation. Today we are divided in a lot of things, but we are divided with the systems, we are divided with the way of prescription, we are divided with our way of prescription. Somebody is using repertory, somebody is using Segal method, somebody is using Shankaran method, somebody is using Vijayakar method, and there is a clear distinction between the how the system work or the information we use in cases. So when we stuck into one system, suppose we are using repertory, we will we normally try to solve every case with repertory. So when we are doing a sensation method like by given by Dr. Shankaran, then we will try to solve every case by sensation method, and same with the Segal's method, and same with the Vijayakar method. And then we got, and we all know that we get failures. So how to overcome that limitation? As I can tell about my journey when I am using predictive. So in acute cases, I am not able, I'm not using Econite because it is not there in the acute chart, because I am stuck into one system. But soon I realized कि in why Econite is not in the acute chart, because at their place in Mumbai there is no cases of Econite, because at their place in Mumbai there is no cases of Econite because no northwest winds. So we have to adapt according to our place and our area and our understanding. So same when I went to another Shankaran system, I stopped using lycopodium because it is not there in chart. So whenever we get ourselves fixed into one box, we get limited. We get limited, and that limitation start expressing in our daily clinical results. So that is why I picked that topic. That is the multi-dimensional approach in homeopathy. That how we can see cases, or how we can take case, or after case we can analyze that case with different dimensions, so that we don't get stuck into these systems or the or our fixed patterns. So we came out of that. So this is the point of today's discussion, that how we can overcome that. So today we will try to understand, we will try to bring clarity about when in a case, suppose we are having a case, when we are sure that this is the case for the repertory. So this is the case, or we can, it is better to say ki when in a case we decide that in this particular case we have to start with the repertory, right? Or any other things also, okay, when to consider pathology in a case, when not to consider a pathology in a case, when to use thematic system, when not to use thematic system, when to use kingdom classification, when not to use kingdom classification. So we should have a clarity in our mind, okay, whenever we start with a case, so what information we are having in the case and what system we are going to use in the case, it should be very clear in our mind. So today, out of these many things, so many things, we will just talk about only one thing, that is how we can, out of so many tools, we can use repertory. One of the tool, repertory, we all use and we all know very well, in a
I
more, in a open way, so that we don't get carried away by the repertory or rubrics. So we should, so that we have clarity in a case, what rubric to take and what rubrics not to consider in a case. As many times we see there are a lot of rubric in a case.
sorry, I just heard back from the, he's not able to log on. I think we'd have another session soon, and we'll email you all so that you can attend this the next session. We're sorry for this technical glitch that's come up where he's not able to log on, and Anita, definitely I'll pass this on to him so he'll answer you, or I will email you the answer that of the remedy that he's used. Yeah, so I hope you enjoyed what you saw or what little you could see of this webinar, and we hope to see you on next week. Next Wednesday, we have a Dr. Dolan Martin. He's from Goa. He's a third generation homeopath, and he's going to be taking up a Materia Medica webinar, recognizing a Baraita as he walks into your place. So until then, saying bye from Chennai and bye to all of you. We'll see you on Wednesday then. Okay. Bye, everybody.